Welcome to TEDxSurrey Conversations with our speakers. I'm Noel Bentley, MC, humorist, and public speaker. I'm also the host and program manager of TEDxSurrey, which was formerly TEDx Bear Creek Park. And today, we're very lucky to have with us one of our upcoming speakers, Dr. Sharlene Gill. All right, Charlene, how are you today?
I'm well, Noel. How are you?
Very good, thanks. Now, Charlene has spent 2 decades as an academic cancer researcher and medical oncologist, and she's helped improve patient outcomes, and she helps guide patients at what are extraordinarily difficult times in their lives. She's also very much engaged in TED in general. And I think she's been to the big TED conference at least twice so far. So now she's wrapped in our TEDx community. All right, Charlene, I'm going to ask you a tough question right off the hopper here. I was wondering if you could tell us about your idea, but without giving us any spoilers.
So, as you mentioned, my background is as a cancer researcher and as an oncologist. And so treating people with cancer is my life's work. And my experience with TED has really amplified for me the power of sharing an idea. And when I thought of the opportunity to audition for TEDx, it was really driven by a conversation that I wish I could have on a one-to-one basis with every patient that I see. And the idea is that we have the power to reframe the narrative of cancer. And it is something that we often feel powerless about when we think about cancer and the fear that is associated with cancer. But I really believe that at an individual level, we actually do have control over that narrative, and that in the right context, it can be very powerful and may in fact further improve outcomes for people living with cancer or looking after loved ones with cancer.
Okay. Yeah, no, I think it's kind of segueing in or even starting into answering what you're wanting people to come away with, because it's sounding like you want a particular shift. Is there something more that you would like people or the long-term reaction to what you're speaking on?
It's a really good question. I think, obviously at a fundamental level, I want the fear of cancer not to paralyze the tools we have actually currently available to be able to control cancer. And the other thing I want is an awareness of the reality that cancer really is I don't want to say ubiquitous, but it's a very common challenge. And I often will joke about the fact that if I'm at a cocktail party or people ask me, what do you do? And I say, I'm an oncologist. There's often this repel, oh, and usually followed by, I hope I never have to see you, and an awkward sort of laugh. But my cardiologist friends never get that. My, surgeon friends never get that, even though those illnesses have a significant burden on life and quality of life. So cancer has a stigma with it that is fairly unique. And so what I hope listeners would get out of the talk is that reframing cancer and shifting our thinking on cancer will actually lead to purposeful and intentional action that will help us deal with, the reality that cancer will affect many of us, and we have to have some intention and purpose behind how we approach it.
Oh, yeah. Oh, fair enough. Well, I'm sorry to hear that the other specialties don't quite get that same thing with.
They don't. My
parties.
Yeah, I'm always the one where it's like, oh, but I understand it. When I first started training 20 years ago, where I work now at my cancer center, we couldn't even contact patients or send them mail that had the word cancer on it, because it was this fear that, it would stigmatize them if they received something in the mail and it said it's from the cancer center. That's the degree of, baggage and fear that cancer carries. And the world has changed and our options have changed, and we've made a lot of progress in cancer. And I want there to be hope, grounded in reality. And again, I think that the power of how our mindset, is immeasurable.
Oh, absolutely. And when you talk about the hope, now we've seen all the advances over the past decades. Is there one thing that's giving you additional hope, where you see sort of a brighter light? Is there something happening that's a little bit more of that maybe not the end of the tunnel, but what's coming up?
Yeah, I love this question, because now you're asking me to put on my scientist hat. So, we have talked about precision medicine and precision oncology for a long time. And the fundamental behind that is that really trying to find the right treatment for the right patient at the right time. And in oncology, it's about trying to tailor that to the sort of the makeup, what makes an individual cancer tick. And now more than ever before, we are in an environment where we can really interrogate cancers molecularly and be able to apply personalized treatments, not for all cancers, but we're making significant headway. And that's what really excites me, is that we really are talking about a treatment paradigm where we are individualizing patient treatments down to their individual cancer. And I think that holds great promise for what can be done. And so that's kind of what excites me. And I'm just gratified that that's something that I'm witnessing in my career as a researcher, and being able to apply that to my patients.
Oh, great. Thank you. Now, for people who might be a little on the fence, or whatever you want to say, or hesitant to join our event in any way, what would you say to them? How would you give them that little nudge?
I think that I think now more than ever, especially living in this pandemic, to be able to put our mind into a forward-thinking perspective is so important, and to be able to share and learn from ideas and how they may impact our lives can be very powerful. So I really feel like if there was ever a time where we needed to be able to, share and learn from one another, and really be hopeful and optimistic about the future, it's now. And so I do hope, to see a lot of folks out there for TEDxSurrey. I'm very excited. I know my friends and family are going to be there. So it should be a good time.
Oh, absolutely. Yeah, it's important to have those cheering sections, but we noticed in the past that when we get close to 1,000 people, it became a cheering section for every single speaker. It was amazing event. So wanted to thank you very much for taking the time, Dr. Gill, and to remind people that for our upcoming TEDx event, please go to TEDxSurrey.ca, where you can see information about tickets and our speakers and everything TEDx Surrey.